Want to call for public assistance with public health, I want to give those numbers again: 735-7327, 735-7575, and 735-7576. That's the number for public health if you are wanting to apply for public assistance.
And we were talking about assistance. Let's go over to the phones where we have Asia Ramos of WestCare, and they've got a few different programs that we wanted to bring her on to talk about. Good morning.
Good morning.
Hi, Asia.
First of all,
Hi.
I know that you guys are in the work of providing services for people who are at risk and who need it most, but I want to just start by asking, how are you doing?
We're hanging in there like the rest of the island, trying to take good care of the clients who are in need of services, those who are most vulnerable in our community, and of course our staff and their families, keeping them all safe and up to date with the latest information.
And we want to get some information out to the people. I saw you guys have put out a release here. And let's just start with the program that offers assistance to at risk of being homeless and homeless veterans.
Yeah. So thank you for responding to that. We feel it's really important that people are still aware that help is available out there. In WestCare, we have a variety of services targeting all sorts of different populations, including youth, couples, families, and specifically right now we're talking about our veteran community. We have a program called the Supportive Service for Veteran Families, and that is really targeting the veterans who are most vulnerable out there. We work with veterans who are homeless, taking them from a housing crisis to housing stability, and we realize that during this time, these services are probably more needed more than ever. We are able to help them with housing stability by providing temporary financial assistance to cover the cost of emergency shelter, rent, and utilities. And more importantly than that, we help them with sustainable options past our services. So they get to work with one of our staff with coming up with plans to help them, whether it's vocational rehab, connecting with medical providers, mental health counselors, just doing more of a holistic approach to ensure that that housing crisis is stable and that they can sustain that housing as we exit from their lives. Mm-hmm. In addition to that, you guys did mention about the food pantry and how nonprofits are becoming very overwhelmed with requests. We definitely have seen an impact in ours. So we have a food pantry available to veterans, and they do not have to be homeless. And we realize that during this time of being on quarantine and lockdown with families and people losing income, that the need for food and sustaining, especially the kids who, depended on those meals while they were in school, are now at home with the family. And oftentimes, it's Nana and Tata are there and everybody's living together. So we do have a veterans food pantry, and we have seen definitely an increase in the utilization of that. But we do still have availability of support with food, and we want to let the community know that this is available to those veterans who are in need.
Mm-hmm. And how does that system work? Is it similar to like the grab and go with GDOE? Do they come to your office and just pick it up and leave?
At this point, we've tried to make barriers as reduced as possible to accessing and also ensure a level of safety where we can be able to have measures in place where we're controlling any sort of, social distancing that might occur and transmission of, goods from one person to the other. So we've actually mobilized our food pantry, which we found has been pretty helpful in getting people, who might be at the most risk, who might not be able to access transportation as easily because they can't afford bus passes. So currently we're mobilizing our food pantry wherein we work with the person who calls in, figure out their household size, what their needs are, and then we have a dedicated transportation driver going out and dropping those packs of food to the families who are in need. Mm-hmm. We also are able to do by appointment only in our office because we're really trying to limit the in and out of the office for everybody's safety, and that's available as well.
Mm-hmm. So how many people are we talking about? How many homeless veterans and veterans that are in need of this sort of assistance are we talking? Because you said you've been seeing, an increase.
Specifically in the food pantry, because you don't have to be homeless to qualify for that. And so we see veterans who have a stable home, but perhaps have had a reduced amount of working hours or no longer have a job, or who are just low income and dependent again on, kids going to school. So on average, I would say per week, we've had 4 to 5 requests for the food pantry, which is an uptick for us. Where when we were having our operating hours, people could walk in or contact us for food pantry, and that probably was around once or twice per week.
Right. But Asia, I was talking with Christine from what I know you know Christine Cruz, also from WestCare yesterday, and I think what Bree's trying to get to the bottom of is the affected population, and we don't have a firm number on that, but she did tell me that over, I guess, the last few years, you guys have been able to assist, I think, almost 500 at-risk or homeless veterans. So there definitely is a population out there, right?
Oh, absolutely, absolutely. And in terms of our numbers, we on average serve about 75 homeless veterans per year. And so, over the course of years that we've been in existence, we've hit about that number that Christina has indicated. But those veterans that we're talking about are not just those veterans who you might see on the side of the street or living in a park or, under a bridge or in an abandoned shelter. What we're also looking at, and where our numbers are much higher, are in those who are transient from home to home. They might be living, with family, and sort of those dynamics kind of run out and they're off somewhere else, or those who are facing eviction, who have lost their jobs or who are in a very, fixed income and can no longer afford like a rent increase. And so those are by much greater numbers. What we've seen are those veterans who are at risk of homelessness or are, facing eviction and having to move out. So those are typically the types of veterans that we serve.
Is there an ethnic breakdown?
We do take some demographics as part of our coordination with Guam Housing Coalition. We have, there's a coordinated single point of entry, and we do take data on that. I don't have the numbers for you right now, Chris, but it's something that we could generate.
It's a real problem because I know, the last couple of years that, people talk about homeless veterans, and a lot of times they're talking about that issue in the States, but it's something that we're living with, and we have been living with this for several years.
Oh, absolutely, absolutely. And I think, it's hard to see our veterans out there who are struggling, and, we're just fortunate to be able to enter their lives and really see a difference when they're in a stable housing and they're able to get back on their feet and, have a lot of successes where they feel more comfortable and those strategies are sustained.
Okay, how about, I know you got a few other programs there. Maybe if you could just run through the ones that are up and running and, who they're targeted to and what type of, services you guys offer.
Yeah. So as with most companies, we've moved to telehealth. And we've gotten really creative in what we're doing. So excited to share some of those strategies. We have a healthy relationships program for couples. And this is an invitation to all couples who are at home together who might be kind of,
tired of each other already?
Yeah, tired.
I'm getting that a lot.
Well, Chris, we'll sign you up.
No, from other people.
They're looking for something to sort of break the monotony, trying to do something different now they have all this time. We're offering virtual workshops focused on healthy relationships, and it's a pretty fun program. It's based on science where you're learning about communication skills, doing fun, talking about how important it is to keep fun in your relationship and how to do that. So that's one of the programs that is currently still enrolling and is actively participating in our community. We also have a counseling program. It's called Uplift Counseling Services. We service those who are insured at this time, and we provide telehealth services either through the phone or over video conference. And so those who might be struggling with what's happening out there in the community, with anxiety levels are definitely increasing, as is social isolation. And you know how important it is in our culture to be connecting with all our family and getting together. That really helps us. So that might be a hard transition for people. So that's our Uplift Counseling Services. We also have a Drug-Free Coalition, and this is a new program for us, but I think it's something that the community would love, is we're focusing on reducing drug use and abuse amongst youth. That includes marijuana, alcohol, and tobacco. And it really is our community coming together in a coalition to focus on Dedido specifically, because we know that that is a hot spot in a highly populated village that could use some intervention. And right now we're rolling out a social media campaign for National Drug and Alcohol Fact Week, and it's a part of a national campaign. So you'll see Guam in there with some of those other communities who are pushing this out. It's called Shatter the Myth. So you can find that on our social media to find out more information about facts for youth about drug use and abuse. And then we also have virtual classes for our youth program, Project Isata, and that's where we're working with youth to teach them refusal skills, how to make good choices, and just general leadership skills. And actually what we've done with that program is we partnered up with DOE. And so we're going direct to parents to saying, hey, we know that there's a need for, positive activities with your youth. So if you have the ability, and we know that some may and some will, but we're trying to capture as many as possible, we're offering virtual classes where we're taking those workshops directly to homes and with parent involvement to keep those kids engaged in something positive.
All right, thank you so much, Asia.
Man,
that's a lot of information.
Hey, I want to give you guys. I want to give you a hand, and all the other NPOs. I mean, there's just so many that running down from Catholic Social Services to Salvation Army to ISA Psychological Services over the University of Guam to Guam Behavioral Health. I know I'm going to forget a whole lot of people. I'm sorry. You know, you're in my heart. You're in my thoughts, and we know that you guys are doing great work. And man, the island is hurting. So I think it's great to see you guys stepping up.
Yes. Well, thank you for giving us the opportunity. We are here for our community. We are just as invested in us getting through this together and showing how resilient we are here on our island of Guam.
Thank you so much, Asia, and God bless you. Have a happy Easter.
Stay safe.
You too. Thank you.
And wash your hands, okay?
I will.
Okay,
And
thank
stay
you.
home.
Okay, yeah, stay home.
Mask
Stay
up.
home. Mask up. 919. Guam's favorite containing COVID. I mean, I just had to read this comment I had gotten